sometimes, but nothing too much, hopefully, okay? I'm just gonna like poke a little bit so I can get some of these little bumpies out. Do you like football? Do you like Brett Favre? Yeah, do you like football?
I like what?
Football.
Football?
Yeah.
No, not necessarily.
Oh, yeah? Okay.
I like to see UFC get beat.
Well, these are, these kind of blackheads you have here are called Favre Raccouchot because they're named after two doctors, I think, actually, and they're from the sun. So a little pressure, I'm going to squeeze these out here.
And he's not in the sun.
Well, back in the day, when he was driving you around, he was a chauffeur, you see? That's why he's mainly on this side.
He likes to drive, yes.
He does? Okay. Not hurting you too bad, am I? I hope not. You're okay? Just trying to get some of these out if I can. They've been in there for a while, and I don't want to push too hard on you.
You can't bother me. You can't hurt
Really?
me.
It's like...
Don't you remember when I cut one of them cancers off with a knife?
Yeah, well, I use numbing and stuff, of course. I'm not gonna be that mean to you. Let's see, come on, little. These are like stuck on you. I'm gonna put a little more pressure on you. Just don't want to bruise you up too much here.
Mama says I don't have any feelings.
Oh, but you do though, right?
As far as pain.
Yeah, okay. See, I just have to work on them a little more. Once I push on them a little bit and I come back, finally they give in to me.
Squeeze you and then
really?
why you yell.
Oh, he's like that kind of rough romantic, huh?
Right.
I reckon.
All right, let's see. I don't know. Those were a little bit stubborn. Let's see if I can get one of these that are closer here. Okay, I'm gonna lift your eye a little bit here. Just see if I can get a couple of these. These are tough because they're hard to get to it over here, and I can't really push against you to extract them. You know what I mean? I can't push against your eye. It'll be uncomfortable. And I think I might. That's why I had you bring the scissor out. I might have to try to snip them off here a little bit. I think they'll come if I just.
What are you calling yourself? The blackhead?
Dr. Pimple Popper.
The Pimple Popper. That's
Right.
It's cute.
And you're the Pimple Poppy. Here
I
they
got
come.
that in my time, yeah.
They're coming now. They're coming. There's another one here. Wait a minute. I just gotta push against you a little bit.
Bruised eye.
Maybe a little bit. You just say you got to get a good story going, I guess, huh? You gotta just tell everybody he acted up. You have to get on him. There we go. See how it's coming out, but it's just slow. They're stuck in there. I have to wiggle this and squeeze. There you go. He's so patient with me though.
He's very good.
Yeah. Is he? Oh. There's a bigger one right there. Good. Stomach running good. Okay.
I guess they've done wonders with these kids in their acne now, aren't they?
With acne and stuff. Yeah, we have some good stuff going with acne. It's just, you know, there's still acne is tough. Acne is a tough thing to treat because sometimes some treatments don't work as well. Sometimes you have to get kind of aggressive with them. And you know, acne is not life-threatening, but if you get scars that are permanent, yeah, that can be distressing to people. I know. Are you okay? You're so
My
tough.
whole face is a scar.
He had acne as a
Oh,
teenager.
yes, yeah. I mean, that's probably why you have a little.
And they're just cute as the bugs here. Now they're getting into the teenage, and
the
then
wrong extract.
one is getting acne so bad it's really ruining their complexion.
Oh, really?
And they don't do anything about it.
We are saying, what are you doing? He says, nothing. And I thought, oh,
Well,
she's gonna
sometimes they don't.
get scarred.
Yeah, that's the thing. I mean, I think that is tough. I mean, and you know, what I think is really tough is when a kid really wants to do something with it and the parents maybe can't afford it, or they're not so interested in taking them somewhere, you know? It is hard. Oh, let's see if I can get these. I know, now I'm on a mission. They're right here. Look, they're right here. Can I get them? Let's see if I can express this here a little bit more. I think I can now. Get rid of these little white bumps on here. He didn't know he was signing himself up for this now. I can't push hard here. That's the problem with these, is they're so close to the eye yet I can't push hard. They're coming. But slowly, and I have to be gentle with them.
Is your husband still working around you?
My what? My husband? That was him next door, yeah. That was him next door. He was being...
They work together.
Yeah. Yep, he's in this office with me. I'm getting as much of these out as I can. There we go. It just takes a little while. Yours are like, they have to be loved first, I suppose. You have to be nice to them, and then slowly they decide to come out. It's like, come on, please, please. And then finally they listen, though not all the way, but I just don't want to push too hard on him. Be very gentle when you're in the area within the orbital bone, you know, on the inside of that bone that you can feel under your eye. Okay, all right, I think those are better. And I just think there was, actually I think that's it really for you. Push my hard right here first. I didn't get all of them. I got better, but I didn't get all of them. That's gonna bother me. When I come back and do your surgery on your forehead, I'll be getting some more.
Oh.
Don't you worry about that. Don't you worry, I'll come back again at it.
Good thing I can't hear these sweet little nothings.
Oh, you were only saying good things.
She's just saying she's going to
I'm talking to your blackheads.
get some more of them when she operates
when I
on
come
your
back
forehead.
again. I think we got a good number there. Actually, I'm gonna get this one on your chin. I'll see this one right here. See that one that's kind of trapped? A little pinch here. There's a little bit of something trapped right there. And then I saw one on his other cheek. Pushing on you. There we go. Cleaning you out a little bit. I think that there's still a little bit there. Good. And then I saw a little bit on the other side, and then we're good. There's a tiny little one on the side. Let's get that one on his lower cheek first. Just push against there and see if you can't get that one out.
What is it, Chandra, or is it Sandra Lee?
It's Sandra Lee.
Sandra.
Not Sandra.
Not Sandra,
Sandra. And not Sandy. Not Sandy. I'm not a Sandy. I have a feeling he might call me that now just to get at me.
Upper
I
crust.
had a math teacher who used to call me Sandy really loud, and all my friends would just go, ah, Sandy, because they knew I did not like it. When I was a kid, you know, Grease was big, and I got teased a lot too that I would, because she was Sandy, Sandra D, you know. So she ends up being, you know, it's pretty cute at the end, but, you know, they made fun of her during the whole movie. I tried to show that movie to my kids last night. They were like, how old is this movie? Like, get out of here, kids. You don't even know. Go back to your Minecraft or whatever you play. Yeah, I think we got, these popped out pretty well. I mean, I haven't really made a nick in those, so that one did really well. Some of these popped out well. We're gonna leave some of them for next time. You did great, thank you for that.